was 13 years old when the political revolution in Iran happened. In a few years, the monarch of Iran was overthrown and an Islamic government took over power. In just a few months, the Iranian government turned autocratic, and my friends and I joined the protest movement against human rights violations. Less than a year later, Iraq launched the war against Iran, which lasted 8 years and caused more than 1 million deaths. The combination of the political violence and the full-scale war with Iraq traumatized me. So at the age of 17, I decided to flee my country and head to the United States to live with my uncle. I was fortunate and privileged to be able to start a new life in America. 3 years after I escaped Iran, I was able to see my family again. And when that happened, I immediately began to sob, and all the traumas of the past came rushing back to me. I realized that forgetting my past life was not an option. I needed to acknowledge the traumas that I had gone through and figure out a way to use those experiences as I moved forward with my life. As an undergraduate, I chose biology as my major and was pre-med, planning to follow the footsteps of my older brother and both my parents. Then I started getting interested in social sciences and philosophy and had a conversation with my father about my career plans. My father told me the story of his experience leading vaccination campaigns for children in rural communities of Iran during his mandatory 2-year military service. He and his team would sit down with the village leaders, drink tea, and explain the purpose of the vaccination program and answer all their questions. After that, they would successfully carry out the vaccination campaign. I was fascinated by this story. That conversation with my father inspired me to choose public health as my career path. When I enrolled at the Yale School of Public Health in the late 1980s, the AIDS epidemic was raging in America. The government had done little to respond to this epidemic, and most of the leadership came from AIDS activists. Working with AIDS activists, it became clear to me that AIDS is more than a medical problem. It is an epidemic fueled by structural inequities, systemic racism, and homophobia. For over 2 decades, I worked on the epidemiology and prevention of AIDS in the United States, China, Russia, and other parts of the Middle East. My AIDS work felt meaningful and important, but my attention started to shift towards the ongoing wars and genocides in Iraq, Syria, Afghanistan, Yemen, Rwanda, and elsewhere. I saw images of tens of thousands of people displaced by conflict in their countries and crossing borders through land and sea at tremendous risk to themselves and their families to get to a safer place. These images brought back my old memories, which I had desperately tried to forget. I asked myself, as a public health academic, what can I do about the devastations caused by war and the toll it takes on human life? Can I apply the principles and tools of public health to prevent these man-made disasters and their negative consequences on the health of populations? As I began this new journey in my public health career, I realized that wars are seldom seen as public health problems. Instead, they are seen as political problems to be solved by politicians and military forces. While there's no doubt that politics and politicians are central to wars, I believe public health professionals also have an important role to play. So what exactly can public health professionals do about wars? Answering this question has been an ongoing journey for me. And today, I want to share 3 lessons that I have learned so far. First, wars affect population health in complicated ways and at different scales. When asked about how war impacts health, many people think of bombs and bullets. They also think that wars mostly impact the lives of armed forces. There is definitely truth in these thoughts, but war takes the lives of both armed forces and civilians. In fact, in the post-Cold War period, there's a common view that 80 to 90% of war victims are now civilians. Historically, healthcare workers and health facilities were safe under international laws, but today that has changed. In Syria, over 800 healthcare workers have been killed deliberately by the Syrian government forces and the Russian allies. And in Yemen, many hospitals and health facilities have been bombed by the Saudi forces. While there's no doubt that bombs and bullets cause death and injuries, there are also indirect consequences of war that cause significant mortality and morbidity, sometimes for years and decades after the war is over. At a broad level, war destroys health systems. Hospitals are devastated, medications run out, and many healthcare workers flee to save their lives. This means that treatments are cut off for people with chronic conditions such as diabetes, heart disease, or cancer. Wars also cause malnutrition, damage water treatment and sanitation system, and disrupt vaccination programs, giving rise to a range of infectious diseases. In Yemen, for example, the destruction of water and sanitation infrastructure has led to the largest cholera outbreak in recorded history. The indirect effects of war also include mental health trauma and rise of self-harm and other forms of violence, from suicide to drug addiction to domestic violence. One of the most important indicators of population health is life expectancy, the number of years a person is expected to live. When you combine the direct and indirect effects of war on life expectancy, you begin to see just how severe the toll is. In Syria, the first 5 years of conflict from 2011 to 2016 dropped life expectancy by almost 20 years. The second lesson I learned is that numbers matter. How many people died in the Rwandan genocide? The estimates range from 500,000 to 1 million, a difference of 500,000 people. Or think of the number of Iraqi civilians who died in the aftermath of the 2003 US invasion of Iraq. During a press conference, former President George Bush reported 30,000 Iraqi civilian deaths. But a team of epidemiologists from Johns Hopkins University published a scientific study in a top-tier academic journal that reported an estimated 600,000 excess deaths, 20 times more than what the US government had reported. Death numbers are highly politicized, and warring parties often under or overestimate mortality numbers to serve their political agenda. Another challenge is establishing the cause of death and linking it with war. Say a bomb goes off a few blocks away and a father dies of heart attack. Should his death be registered as war-related? Or say a grandma with a severe heart problem is not able to access her medications due to the disruption of the health system caused by war and dies as a result. Did grandma die of war-related causes? Every death matters, and public health professionals, especially those with expertise in mortality and disease surveillance, can generate accurate science-based numbers and causes of death, even in regions without government control. For example, there are over 4 million people living in northern Syria, which is not under government control. This region lacks a mortality surveillance system, so the world does not know how many people are dying in this region and of what causes. To address this problem, my colleagues and I are currently working with Syrian civil society organizations in this region to establish a mortality surveillance system to help answer these crucial questions. Finally, can we prevent wars? This is perhaps the most important question for public health professionals. After all, our profession is obsessed with prevention. In public health, we put prevention in 3 buckets: primary, secondary, and tertiary. By applying this framework to war as a public health problem, we can start to put together novel approaches for the prevention of war. Primary prevention is about taking measures that prevent the onset of illness or injury before the disease process begins. We vaccinate kids against polio so they never have to experience it. But is there a vaccine against war? Not that I know of. But if we dig deep in understanding the root causes of war, then we should be able to come up with interventions that reduce the risk of war from getting started. Secondary prevention is about measures that lead to early diagnosis and rapid treatment of a disease, illness, or injury to prevent the problem from becoming worse. Examples include screening for high blood pressure or high sugar levels. In the context of war, can we screen for the effects of conflict on affected populations and take measures to prevent their further spread? I believe the answer is yes. Tertiary prevention involves measures aimed at rehabilitation following significant illness. For public health professionals, that would mean focusing on the victims of war and how they can reintegrate back into society and rebuild a life after the trauma they have experienced. For example, can we help child soldiers recover from their traumatic experiences and go back to a normal life? The public health professionals have the knowledge and expertise to do that. I'd like to end my talk with a positive idea: health as a bridge to peace. Health as a bridge to peace refers to efforts by health organizations and health professionals to not only improve health outcomes, but also contribute to promoting peace and reducing conflict. In the mid-1980s, El Salvador was going through a horrific civil conflict. One of the many terrible consequences of this conflict was the disruption of the vaccination programs and the rise of deaths in children on both sides of the conflict from polio and other vaccine-preventable diseases. Public health organizations such as PAHO, UNICEF, and the Red Cross partnered with the Catholic Church and convinced both the government and rebel forces to agree to days of tranquility, when the hostilities would be paused and allow for vaccination of children on both sides of the conflict to move forward. These days of tranquility were held every year from 1985 to 1991. During these days, nearly all children in El Salvador got vaccinated, and their mortality dropped significantly. But something else also happened. During these days of tranquility, government and rebel forces began the peace negotiation process, and a year later, a peace agreement was signed, which brought an end to the civil war in El Salvador. While it is difficult to measure the exact contribution of the vaccination campaign and days of tranquility to the ultimate peace agreement, there is no doubt that public health organizations played a major role in promoting peace negotiations in El Salvador. So, as public health professionals, can we do something about wars? Yes, we have to. But to create lasting peace in the future, we must build unity among all the key stakeholders, from political and military leaders to public health experts, from diplomats to engineers to historians to business people. The fundamental principle of public health is building communities and collaborations to achieve health. To prevent war, we need to recognize that all of us have a part to play. Today, I have presented you with a few ideas, but now I invite you to recognize that the future of our quest for peace starts with you.